Most women won't experience any early signs of pregnancy until the fertilized egg implants into the uterine wall, on average 6 to 12 days after ovulation. Other women may notice no signs of pregnancy until a delayed or missed menstrual cycle, one of the most pronounced and significant symptoms of pregnancy. Whether you're trying to get pregnant, or trying not to, it's important to understand indicators of pregnancy because each symptom may be related to something other than pregnancy. Below is a list of some of the most common first signs of pregnancy, some of which may occur before a home pregnancy test can be used, letting you know that you may be on your way to becoming a mother. You may experience all, some, or none of these signs that you could be prego. 1. Food cravings. Admittedly, it's a cliché, but food cravings sometimes can be early signs of pregnancy. Don't rely on a hankering for pickles and ice cream as a sure symptom of pregnancy. It may be all in your head or even a sign that your body is deficient in certain nutrients. However, if cravings are accompanied by some of the other symptoms on this list, it could mean that you might be eating for two. What else? It could mean poor diet, nutritional deficiency, stress, depression, or impending menstruation. 2. Darkening of your areolas. If the skin around your nipples darkens, you may be pregnant, though this may also mark a hormonal imbalance unrelated to pregnancy or be a leftover effect from a previous pregnancy. What else? It could mean hormonal imbalance unrelated to pregnancy or maybe a leftover effect from a previous pregnancy. 3. Light bleeding or cramping. Implantation bleeding can be one of the earliest signs of pregnancy when, about 6 to 12 days after conception, the embryo burrows into the uterine wall. As a result of this, some women will experience implantation spotting, slight staining of pink or brown color, as well as some cramping. You might mistake implantation bleeding for a very light period, as spots can occur around the time you expect your period. What else? It could mean actual menstruation, altered menstruation, changes in birth control pill, infection, or an abrasion from intercourse. 4. Frequent urination. Once the embryo implants and begins producing the pregnancy-sustaining hormone secreted by the embryo soon after conception, usually around 6 to 8 weeks after conception, you may find yourself running to the bathroom more often. What else? It could mean urinary tract infection, diabetes, increasing liquid intake, or taking excessive diuretics. 5. Fatigue. Feeling drowsy? No, make that absolutely wiped. High levels of the hormone progesterone experienced during pregnancy can make you feel as if you've run a marathon when all you've done is put in a normal day's work. This hallmark of early pregnancy can appear as soon as the first week after conception before a positive pregnancy test can be performed, but don't necessarily assume you're pregnant just because you're feeling exhausted. What else? It could mean stress, exhaustion, depression, common cold or flu, or other illnesses can also leave you feeling drained. 6. Tender, swollen breasts. If you're pregnant, your breasts will probably become fuller and increasingly tender to the touch, similar to the way they may feel before your period, but more pronounced. These changes may begin as early as 1 to 2 weeks after conception. What else? It could mean hormonal imbalance, birth control pills, impending menstruation, PMS can also cause your breasts to swell and become more sensitive. 7. Nausea. As early as a couple of days following conception, you may begin feeling nauseated and queasy. It will often show up between 2 to 8 weeks after conception. Despite the common name of this well-known sign of pregnancy, morning sickness, it doesn't only kick in during the morning hours. Pregnancy-related nausea can be present at any time of day or night. If you're lucky, morning sickness won't hit you until a few weeks after conception, and some women are lucky enough to escape it altogether. What else? It could mean food poisoning, stress, or other stomach disorders can also cause you to feel queasy. 8. Backaches and headaches. Lower backaches and headaches may appear as early signs of pregnancy as a result of the sudden rise of hormones. What else? It could mean impending menstruation, stress, back problems, and physical or mental strains, dehydration, caffeine withdrawal, eye strain.